All right, I think let's go ahead and get started. Thank you everybody for joining. We have a lot of people logged in, which is really great. Seeing 111 participants here. So thank you all for taking time out of your day. And sorry we can't all be together for a normal town hall, but this is going to be a really great hour of your time, I hope. We have some great people who are here to share some information with us and answer your questions. So I want to thank you all for being here again. I'm Dylan Roberts. I'm the state representative for House District 26, which is Eagle County and Routt County. And I'm hosting this town hall with Senator Kerry Donovan, who you'll hear from in just a moment, who also represents Eagle County as well as several other counties. We know this is a really tough time. We at the legislature are not in session because of the coronavirus pandemic. And so we are back tending to all of you, our constituents, and trying to help you through this tough time as much as everybody else on this video chat is as well. We wanted to take this time to connect with you and answer your questions, but also give you an update, especially since it's our mountain communities that are getting hit the hardest right now in Colorado with this. So that's what we're here to do. Like I said, the legislature is no longer in session, and that's sort of my update, but what we want to hear from you is things that we can work on for when the legislature does go back, some ideas that we can bring back to the Capitol to work on for you and work with our local partners to help with the recovery that we're going to need to go through after this. We'll get into more of that in just a little bit and start answering some questions, but I want to give everybody who's on the line a chance to introduce themselves and give an update on their end. So first, I'm going to go to Senator Donovan.
Hi, everyone. Thanks again, as particularly to our healthcare workers who are taking time out of their already incredibly busy days to join us. We really appreciate you guys for everything that you're doing, and really appreciate you finding some time to help us talk to everyone who's logged on to this video chat today. So yeah, I mean, I think the story across the mountain communities is similar. We were the first to get hit in significant numbers. We ended up last week, I think, actually, I'll try to put a positive face on it, even though we've had some tragic consequences of COVID and lost some people that we know in our communities. I think because our communities were so well organized, and had such strong communication systems in place, that what I'm seeing is that the issues that we were able to elevate, raise, and illuminate have now prepared the rest of the state to be in a better place, as we suspect that the rest of the state will also experience this to a significant degree. So I'm really appreciative of our county commissioners, everyone who is involved in our emergency communication teams, of their willingness to kind of react, respond, and then share the learned experiences that our mountain communities have seen, because it's really going to do a service to the rest of the state. So know that Representative Roberts and my offices are still up and running. We're both working from our dining room tables, as you can see, but that doesn't mean that we aren't here basically 24/7 over the foreseeable future to either, I mean, the emails I've gotten have varied from people being stuck in Peru and Guatemala to trying to figure out how to get infant formulas to families, because we were seeing some shortages because of some panic buying. So no question is off the table, and we're here to help you guys. If you're a constituent, if you're a small business owner, if you're a healthcare professional, your eyes are really valuable to us, because we can relay those issues to the state and help the entire do a service to the entire state to help them prepare. So I will stop my comments for there, but look forward to learning a bunch from our healthcare workers that are on front lines, our county commissioners that are really the critical local decision-making force in this issue, and the others answer questions from people. So thanks for joining.
Great, thank you, Senator Donovan. And next, let's go to some of our Eagle County Commissioner, Kathy Chandler Henry.
Hi, everyone. Thanks a lot to Representative Roberts and Senator Donovan for hosting this town hall and for inviting us to be a part of it. Kerry, I think you did a really great job sort of teeing this up. We are seeing some big impacts in Eagle County. This morning we had, as of this morning, we have 194 lab confirmed cases We also have a great self-monitoring form out there where citizens can report their symptoms. As of a few minutes before this call, we had 765 people who have reported in on that. I think our public health director is going to talk a little more about what those numbers mean and what they don't mean. But what I wanted to let you know is that we are following the 4 goals of our incident command here in Eagle County, and that's led by public health. And that is firstly to slow the spread of this disease. Second is to ensure our medical system capacity and continuity. Third is to protect our most vulnerable residents. And the fourth is to look ahead to where we want to be in recovery, both economic and social. We had our first case on March 6th. On March 7th, we did declare an emergency. That was ratified on March 10th and extended through April 8th. So we'll take another look at it at that time. Every morning at 9 o'clock, we have a call that is hosted by our Emergency Operations Center where we talk to all of our partners, many of whom are on the line right now. And I just want to say from a policymaker view, it is incredible to see the cooperation, the collaboration that those teams are doing and to see the difference that it's making in our community. I do think that even though we have a lot of cases, we are well ahead in our response to COVID. So that's it from me for now, and I look forward to hearing some questions from all of you.
Great, thank you, Commissioner. We're working on getting Commissioner Corrigan from Routt County up on the Zoom. He was next, but let's go to Commissioner McQueenie, also Eagle County.
Yeah, hi. You can hear me, right? You know, that's our new drinking game. I think I'm on mute every time. All right, so I was going to speak a little bit about the aid package that we were able to approve yesterday. So we have approved $1.15 million in additional aid. Primarily, it's to support our most vulnerable populations, and that includes all of those folks who have just been made unemployed. But it includes $250,000 for our community partners who were already doing some of the work to be that safety net for our community. So it's the organizations like the Salvation Army and food banks and such. And then we also allocated $500,000 to the EOC so that they can determine what the priorities are for that. And it could be around medical supplies. It could be more around food. It could be around housing, but we'll leave it to the EOC to determine how to spend that $500,000. And we also allocated an additional $400,000 to our Human Services Economic Development Department. And so they yesterday that was Tuesday, we pushed out a form that people would use to apply for emergency assistance, financial assistance. And they've had over at 1 o'clock this afternoon, they had over 1,000 responses to that form. We also allocated to them from folks within Eagle County government who were sort of freed up from their current work, 20 more people that can help process those applications. So we're hoping that will help with the initial crisis people are feeling in terms of their rent check or the ability to get groceries or pay a childcare bill or a utility bill. So our Human Services Department, that's what they have long been able to do. They know exactly how to connect people with services and with programs. And interestingly, the town of Vail just came up with a fund that they're going to be helping their residents with. And so hopefully it will all be a coordinated effort so that Human Services will know what's available to residents and get them signed up to the right programs. And, you know, we believe this was probably our first pass at this. We didn't really know what the numbers would be and what the need might be. And so more than likely, we will have another supplemental budget to approve in the next month or so.
Thank you, Commissioner. And let's go to Commissioner Matt Scher in Eagle County.
And thank you, Dylan and Kerry. We really appreciate the work that you guys have been doing, even though you're having a little hiatus. One of the things I wanted to talk about was it's important to note that for emergency services, there are lots of categories. They're called ESFs, or emergency service functions, and one of those is recovery and mitigation. So on that front, our team deals with economic recovery and mitigation, among other things. Mitigation in the short term includes measures such as the funding that Commissioner McQueenie mentioned. That's very important to keep everybody afloat right now. And it also includes some of the public health measures that we've done. We're allowing, for example, some businesses to remain open that we feel can achieve social distancing but not threaten public health. And that can preserve some economic activity and prepare our community better for a rebound. We have a tremendous partner in our valley-wide chamber, the Vail Valley Partnership, who is serving as the clearinghouse for business-related information and resources. And recovery also means planning for the very new landscape we're going to find on the other side of the curve. So there are near-term 1 to 3 month objectives, intermediate 3 to 6, and longer-term 6 to 12 month focus areas. The near-term highest priority is keeping as many local businesses and employees intact over the next few months. We're focusing, Adam Palmer and Morgan Barrell were running this, calling it Getting to June, where hopefully we'll be through the wave of this epidemic and getting into the summer tourism economy. We'll keep our fingers crossed. And the longer term, we're really looking at revisioning to incorporate lessons that we've learned into other activities, including our comprehensive plan, climate action collaborative, resilience plan, economic development strategies. It's really how can we use this disruption to learn from and inform how we can be more resilient and sustainable in the future.
Thank you, Commissioner. So us as elected officials are so grateful to have some of the health officials that are on the call today who are really doing the hard work of keeping our community safe and healthy. And so I'd like to get started on that front with Heath Harmon, who's the Director of Public Health and Environment for Eagle County. Heath.
Hey, thank you so much. Hey, first thing that I wanted to point out relative to the responses, this is a community level response. We have tremendous partnerships throughout Eagle County. Vail Health and Colorado Mountain Medical, who are on the line as well, are some really important partners. And so I just want to acknowledge that realistically, there are a lot of heroes that are responding to the event. I'm also wanting to acknowledge the fact that we do have in Eagle County our fair share of cases. As Commissioner Chandler Henry had reported a little bit earlier, those numbers are really high. And I also want to point out that we benefit in our community because of some of those great partnerships and the testing that is coming from our medical providers. We have an awful lot of testing that is actually happening in our community. We still prioritize where we need to make best use of certain limited supplies. And a lot of times that's in personal protective equipment to make sure our healthcare workers are not getting exposed while they're performing the test. But nevertheless, when we test a lot, we're going to see a lot of cases. I don't necessarily know that we're seeing anything different in Eagle County than what we might see in other jurisdictions, but thanks to our medical community, we're testing a lot, so we have a lot more information and a greater ability to actually know how we want to respond to the numbers and to the incident here within our community. So that leads me then to the last thing that I'll touch on up front, and that's our public health orders. There's been an awful lot of conversation and questions among others in our community around the different stay-at-home and shelter-in-place orders that we're seeing in numerous other communities throughout the state as well as the nation. One of the things that I really wanted to point out to everybody on the line today is that when you take a closer look at those actual orders, the language in terms of what's prohibited, what's exempted, what's essential, our orders are really on par with those other stay-at-home orders that we are seeing pop up. And so a lot of the difference might be in terminology. Nevertheless, we are focusing our efforts in some similar messaging just around staying at home to the degree possible, right? Realistically, to get to obtain essential services is the time that we really want you to be out and away from home. It's still okay to exercise. We just need to acknowledge that when we're doing these things, that we're doing it with that social distance in between us, so that we're not exposing and or becoming exposed to others. So for what it's worth, I think we've done a lot of work with our community partners to implement orders that are first and foremost focusing on health and safety, while at the same time really striking the balance with what the needs are in our communities socially and economically. So again, thanks for hosting the town hall. Look forward to answering some questions.
Great, thank you, Heath. Next, let's go to Will Cook from Vail Health.
Good afternoon, everyone, and thank you, Representative Roberts and Senator Donovan, for hosting this town hall. A special thanks to all of our elected officials who have responded swiftly and meaningfully to ensure that your health system has the resources it needs. As has already been stated, a lot of these mountain communities were hit hard and first, in large part because of our international ski resort designations. And, for a period of time there, we were feeling the rush of surge, and we had staff, personal protective equipment, and other resources sent to us almost instantaneously. While it's too soon to say whether or not we've peaked, it would be irresponsible to say that. We're hoping clearly that this can come and go as fast as possible to get back to normal. But I wanted you all on the call to know that your hospital is healthy. It's safe. We've got capacity. We have staff. We have professional personal protective equipment. We've got ventilators. We've got negative air pressure rooms. We've deliberately set up screening systems outside of the hospital so that people aren't brought into the hospital setting, because we're trying to preserve that. And we're extremely grateful from the help that we're receiving, not just from our elected officials, but from the community at large. So I will stop there to save time for others who want to speak and to let us field questions at the end. But again, just want you to know that we are ready and prepared and extremely grateful for the outpouring of help.
Thank you, Will. Next, Dr. Bach. Like Chris is gonna.
Chris is going next door to help with technical issues, I believe.
That stays, you said. Yeah. Hi, my name is Brooks Bach. Sorry. I'm the CEO of Colorado Mountain Medical. And in concert with Vail Health, we've been able to put in place a very comprehensive system that helps to utilize resources that we have available in the community in the best way possible. And I want to describe that for you a little bit so you understand what we've done and why we've done it. One of the first things we did was we converted an urgent care facility in Gypsum into a COVID testing facility. And people call, there are 3 places you can call. You can call either the Avon Urgent Care Center, you can call Mountain Family, or you can call a Colorado Mountain Medical Office, and you can be then forwarded to, your name will be forwarded to the Urgent Care Center lines, and they will make you an appointment if you're appropriately screening, and you will have an appointment to come in and in your car be screened for flu, for strep if you should have a sore throat, and then for COVID-19 as well. And that's worked very well and has been in place since the early days of it impacting our community. Additionally, we have set up 3 what we call respiratory clinics. One is in Vail. It was the first one we established. We added additional rooms so we could care for patients initially who had fever, who had cough, who had shortness of breath, and keep them isolated from other patients who were being seen in that clinic. We established a second such facility in Eagle, in the lower level of the Eagle Healthcare Center. And thirdly, at the Avon Urgent Care, we have our third. And we've expanded testing criteria very recently to include things like headache, sore throat, body aches, loss of smell, loss of taste, diarrhea, symptoms that we're finding elsewhere and also in our own community are being experienced by patients who are testing positive for COVID-19. So we have the testing facility, we have the respiratory clinics, and all of that is done to protect the rather important resource of the hospital, its emergency department and its inpatient unit and ICU, to protect it for the more severely ill patient. And that has worked, and it's worked very, very well. And I want you to understand that is available to the community as a result of the collaboration. Thank you.
Thank you, Dr. Bach. All right, let's go back to Vail Health and hear from Chris Lindley.
Hey, thank you. So I think the medical stuff has been covered really well. I want to talk about the other issue that we're all so much aware of, and that is the reality that the social emotional effects of this will probably likely be worse than the illness for the majority of the residents. You know, closing the businesses, the isolation, the changing of the daily routine, these are hard things. This is behavioral health, and this is what Eagle Valley Behavioral Health and all the great partners in the Valley that have been working on the mental health for so long have been focused on. So I want to just give you a few things that they've been doing. And again, as Heath also alluded to, this isn't one organization, it's everybody coming together. And I want to echo his comments because it's really been a great synergy of efforts. But if you go to eaglevalley.bh.org today, you'll actually find a link to all of our resources to help folks get through this on the mental health aspect of this, how to deal with anxiety, how to deal with your kids when you're staying at home, how to fall asleep at night and slow down the mind. Simple things that we take for granted, we have up there as great tools for everybody to use. We've also gone through our entire provider directory, which is every licensed behavioral health provider in this valley, and we've labeled all of those that are now offering telehealth. And the other thing we've provided with all of them is free telehealth support. So they're all hooked up now and can provide telehealth support to anybody. So if you're at home, if you're in need, regardless of where you're at, we have providers that are available to see you today, and they can do it through the computer, just like we're talking here today. And I also want to just talk about some amazing just outreaches of support from the community. We have 2 board-certified psychiatrists in this valley who have stepped forward free of charge, that they're retired, and are now providing free psychiatry services to all of our clinical support staff. And that is just not only an amazing gift to our frontline heroes, I think is what we're referencing, all the healthcare workers, but everybody in this community is trying to find a way to participate, trying to find a way to help out. And it's that love, it's that emotion and support that I think is going to get us through this really hard psychological challenge. At the same time, we're also physically fighting this illness. That's it.
Thank you, Chris. All right, and our final panelist, at least for now, we're still working on Routt County Commissioner Tim Corrigan, who hopefully can get in soon, but we'll go to Dr. McCorvey from the Vail Health Emergency Department.
Hi, I'm Scott McCorvey. I'm one of the ER doctors at Vail Health. And first I want to thank Representative Roberts and Senator Donovan for hosting this. I think it's really important for us to interact with our community and share some of our experiences. First and foremost, I want to let you know our emergency department is open. We are staffed fully. We are ready for anything that comes to us. But there are some changes to expect if you do come to the emergency department. And, right now, if you were to come to our hospital, you'll be directed towards the entry to the emergency department and you'll be screened. You'll be met with someone that asks you if you're there because of the symptoms of coronavirus, or if you're there for some other evaluation, say if you're having a stroke-like symptoms, or maybe you're having a musculoskeletal injury like a broken leg. If you are screened positive for symptoms of coronavirus, then you will be directed into our isolation tent or into the emergency department for an initial evaluation to try to determine what resources you need and how we can best take care of you. Once you get into the emergency department, you'll be taken to one of our new private rooms, which is very helpful. And then one of our nurses will meet you in the protective equipment that has been discussed. And we'll begin to evaluate you in terms of severity of illness and see what interventions you need from us. We have full capabilities to evaluate and to screen and to We're open 24 hours a day, 7 days a week, 365 days a year. Our volume is down right now because of the collaboration that's been discussed already. And so what we're seeing in our emergency department are patients that are very uncomfortable and very sick and that need our help right now. And so we look forward to seeing you if you need us. We're there all the time. Please reach out to us if you have any questions.
Thank you, Doctor. Thank you, everybody, for those updates. Now I want to get into what I think most everybody who's tuned in would like to hear, and that's going to questions. For those of you, many of you have submitted questions online beforehand, and so we're going to go to those questions first and then get to as many of the questions that are coming in via the chat box. Any of our panelists, you can see the chat box. Hopefully, please feel free to respond to those questions as we go as well. We can get as many of these answered as possible. The first question we're going to go to is one that I'm going to kick over to my colleague, Senator Donovan. It was, can the governor provide a timeline for people to return to work, perhaps in 2 to 3 weeks more, especially if we can test? Senator Donovan.
Yeah, thanks for that question. And I think what we need to find with the balance of this questions is the anxiety of wanting to get back to our routine and the things that we know and feel like we're being productive, but also being aware that we are still very early in this pandemic. And so this is going to be a constant push and pull on this type of question. Right now, I would say that the state is listening to our leading epidemiologists and taking their recommendations while working with our kind of local boots on the ground folks to flatten the curve. That's our primary goal right now in Colorado at the state level government, working with Governor Polis, his team, and getting feedback from our county officials and frontline healthcare workers. So we're looking at flattening the curve right now. We do not have a date at this time, even under consideration of when we might be able to talk about returning to work or lifting some of the social distancing, extreme social distancing, and stay-at-home guidelines that some parts of the state have enacted. So I'm sure you wanted to hear a different answer of being able to say a date certain where people will be able to return to work. But at this time, our focus is on flattening the curve, making sure that we are stopping transmission so that we don't overload an already stressed healthcare system. But if you are someone who needs more information, I would suggest find some trusted resources online, some news sources, and see how long these have played out in other countries that are months ahead of us. You can look for that as some guidance and inform yourself. But at this time, we're focusing on flattening the curve and don't have any for certain date of when we might lift the possible actions that we're asking individuals to take in order to avoid transmission.
Thank you. And it looks like we have our Routt County Commissioner Tim Corrigan has joined us. So I'm going to go back to updates. I know there's some folks from Routt County and elsewhere in the state who would like to hear from him. So Commissioner Corrigan, go for it.
Hi, Dylan. Thanks for having me. So quick update. We had 3 new cases in the last 24 hours. We are up to 10 confirmed cases. We have instituted 2 public health orders, one limiting gathering to 5 people or less, with some specifics around larger businesses. And we have we've issued a public health order prohibiting short-term lodging anywhere in the county. Our EOC is up and operational. Like many other counties, we are really struggling with the lack of testing capability to the point that, in my opinion, the testing is becoming less relevant, and we really need to move on to the stricter kinds of mitigation measures. We are considering, and I would say we're moving in the direction of probably issuing a stay-at-home order within the next 48 hours as we put together the details. So that's my quick update.
Thank you, Commissioner. Definitely brought up some things that we'll be talking about in some of these questions that have already come in. The next set of questions, we received a lot of questions, totally fair questions about testing and what is the status of getting more tests, or should we be testing? Were many of those. So Keith Harmon, or Dr. Bach and Heath Harmon are going to start with those. They've seen all of the questions that you guys submitted earlier about testing. And so, they all kind of go on the same theme. And so I'm going to kick it over to Dr. Bach, and then we'll go to Heath to talk about testing.
Thank you. The testing situation actually has improved significantly over the number of weeks that we've been involved. And I want to give you some history so you understand what happened. Initially, we were testing and we had a single place to send that test. That was the state laboratory. As testing took place throughout the state, that laboratory became overwhelmed, and it was very difficult for them to turn around tests in a rapid fashion. About 10 days ago, the commercial laboratories began testing. They began testing initially in California, in Washington, in New York, much larger areas with many more patients. And then eventually they began testing in Colorado. And we changed both at Vail Health and at Colorado Mountain Medical to testing at Quest. And we're now seeing 2 and sometimes 3-day turnarounds. So we're getting our results much more quickly, and that's a very positive thing. We've had about 200 patients test positive in Eagle County to date, and we will continue testing in all of the sites that I mentioned previously when I discussed kind of the setup that we had created across the state. And there is availability for testing for anyone who has mild to more severe symptoms on a daily basis.
Great, thanks, Dr. Bach. I'm happy to jump in and add a couple of more thoughts. I think I'm hearing loud and clear from folks, day after day about some of the frustrations with testing. And I understand that. I think Dr. Bach just gave a really good example and explanation in terms of some of the progression and how things initially started off really in one lab, and now we're expanding and getting a much better turnaround. I also want to acknowledge that there was a period of time, even when we got Quest online in the state of Colorado, that first batch, they were overwhelmed in receiving all of those results. And so actually, I think that first batch took a little bit longer to get some of the test results, where we were actually seeing about 4 or 5 days on that turnaround compared to what we are seeing now. And so I think we're in a much better space in terms of being able to get the test back in a timely fashion, which is great. I would also highlight, thanks to Dr. Bach and Vail Health and other medical providers in our community, that we are submitting anywhere between 80 and 100 tests daily for COVID-19. And so I don't know what that compares to in other jurisdictions, but I just want to highlight that when we do test an awful lot for the disease, then we're more likely to be able to find it, which then allows us to be able to do a better job in terms of issuing some of the isolation and quarantine orders as a follow-up. One of the things that I would also want to talk about is the questions that I've seen about prioritizing the test specifically for people that are at higher risk for severe disease. And I think what we're doing is early on, when we were struggling with a lot of the testing in terms of timing and availability, that was really important for us to be able to put in place some guidance for our medical community, just to help preserve the limited resources in the time that we had. That said, as things continue to evolve, that guidance does evolve as well. I would highlight here that even though that we might have a list of prioritized populations, if you will, for testing, be it severe, risk for severe disease and or people that are actually helping to respond to the incident, like our healthcare workers, we're still leaving the decision into the hands of our medical community. So it's our medical providers that best understand what the needs are for their patients and also understand what the capacity is within their system relative to PPE or personal protective equipment, and also our healthcare workers. So I think realistically, what I would convey is it doesn't matter where you live in the United States, testing has not been ideal. That said, what I feel our medical providers have been able to put in place within Eagle County is really phenomenal. The turnaround is great. And again, seeing that data and having those conversations with people that are actually getting those test results is really important for us to be able to implement the best control measures directly with that individual and their household members.
Thank you, Heath. All right. Next question is, do you have an idea of when the legislative session might reconvene or aim to reconvene? When will we know the results of the Supreme Court interrogatory? I'll take that one real quick. So as many of you know, the legislature adjourned a little over a week ago due to the coronavirus pandemic. And we set a date to come back of March 30th. That was just a guess at that point. We will be heading back on March 30th, but we are going to quickly come back and then re-adjourn because it's not safe to come back yet. There is no estimated date on when we might return that second time. But the big question is how much time do we have left in the legislative session? The Colorado Constitution allows the legislature to meet, or says the legislature must meet 120 days every year. It says it should meet 120 calendar days a year. It doesn't say whether those have to be consecutive or if you can take a break and then resume. Because we don't know the answer to that question, because this has never happened before, we as a legislature sent a question to the Colorado Supreme Court and said, can you help us interpret this and let us know whether we are going to lose all of these days that we're out, or if we'll have the 50 days left that we had left when we adjourned to about a week and a half ago to come back. We still need to pass our yearly budget. That's one of the main things we have to do. We have to pass the School Finance Act and a few other bills that we're required to do every year. And then obviously we'll have legislation, hopefully, that can help respond to this crisis and help both with the response and the rebuilding. So we're hoping that we will have some time left. We will know, the briefs were submitted to the Colorado Supreme Court yesterday. They're going to take up this question on Thursday, tomorrow. And it's unclear how many days they will take to rule, but we're hoping we'll have an answer by early next week. And it's hard to say which way it'll go at this point. But I can say we will be back to the Capitol in Denver at some point. And whether it's in a normal session or in a special session, we will be back to work and hope to incorporate a lot of ideas that we're getting during this time to help recover. So that's that question. Next one is specifically for Routt County. So I'm going to go to Tim again. It says Routt County just announced a really strict non-visitation policy and closing of businesses. What is this and how will the non-visitation policy be enforced?
Thanks, Dylan, for that question. So the non-visitation policy is actually a short-term ban on, or a ban on short-term lodging of anything less than 30 days. And it extends to all of our lodging facilities, including RV campgrounds, any other kind of short-term rental, VRBO, anything like that is prohibited. The compliance, the enforcement mechanism is a $5,000 fine or up to 18 months in jail. I don't expect that we're going to be enforcing it to that level. I think the order is intended to get our lodging community to voluntarily comply with that so that we can stop the number of people that are coming into Routt County.
Thank you, Tim. Appreciate that. The next one is about federal response and state response in the terms of financial support for the business closures that we've seen. The question is, much of the financial support being discussed at the federal and state levels have been focused on W-2 employees and their employers. Is anything being discussed to help sole proprietors, small businesses, independent contractors who seem to be falling through the cracks? I'm going to kick it over to Senator Donovan, and we'll see where that discussion goes.
You're giving me the easy ones, Dylan. Jeez. Sorry, guys. I'm going to look at my notes on this one. So sorry that I'm staring down on this conference, but want to make sure I get some of this information right. Last night, they did pass a large $2 trillion coronavirus stimulus package in DC. As you would imagine, a $2 trillion package has a lot in it, but I wanted to make sure you knew some of the details. And sorry, let me correct myself. This is what they're considering. It hasn't been passed into law yet. So sorry, an important clarification there. But we think this is what could be included in that stimulus package. And a few highlights that I'll give to you guys, and then include links in the chat panel for you guys to look at it more. But again, this is the federal stimulus package that I'm talking about right now. They're looking at putting $600 per week on top of the unemployment benefit for everyone who applies. In order for expediency, they're just kind of doing an across-the-board increase. On top of the unemployment benefits that they're looking at closely, and they're and actually a lot of, because of feedback from our district, it is a broader definition to include freelancers, furloughed employees, and gig workers as part of that unemployment package. That's significant for our resort and rural communities. Additionally, we hope that this stimulus package will include $1,200 in direct payments to taxpayers with incomes up to $75,000. So that's a $1,200 direct payment to each taxpayer, with an additional $500 per kid in that household. There's still details of how that check would be via direct deposit or a check in your mail. But that is probably one of the most significant aspects of this $2 trillion stimulus package. Additionally, they're looking at investing $150 billion into what they're calling a Marshall Plan for the healthcare system. This obviously $150 billion will be parsed out in different ways, but it does include $100 billion directly to the frontline healthcare systems, think hospitals, rural healthcare community centers. An important part that I want to highlight is they did also include $1 billion to go to the Indian Health Services. So that was a really important aspect that was added in for the overall health of our county, is focusing on our Indian Health Services as well. It also includes, this is now some more information about business. They've put in the proposal right now, $10 billion for immediate small business assistance. So those would be loans that you can apply for, I believe, up to $10,000. I'm checking my notes. I'll correct myself if I'm wrong on that. And that's in the, $10,000 for immediate relief for small businesses, and then an additional $17 billion for relief over the next 6 months. So kind of an immediate influx of money, and then $17 billion to cover 6 months of payments for small businesses that have existing small business assistant loans. So it's loan assistance. Additionally, they've put in $30 billion into education funding, $25 billion into transit, and then $75 billion that's kind of industry specific. Those are some of the things that you've been hearing about, such as like the airlines. So that's a big overview of $2 trillion. These are very, very significant, important funds, because one of the conversations that we're having at the state already is the impact of COVID-19 is going to be so significant across so many sectors that we really are going to rely on the federal government to help the state and the state can help the counties, counties can help cities, and so on and so forth. Another thing that I just want to flag while we're talking on this broad topic, this has already been decided, not part of this bill that's being considered, but already been announced, that tax day at the state and federal level has been moved to July 15th. So that'll be important for everyone out there to know that, and I'll also include a link on that. As far as the state reaction goes, we are trying to respond to basically the issues and concerns that have been raised by the calls and emails that Representative Roberts and I have been getting over the past 10 days. The original state of emergency was declared March 10th. And since then, our districts have really been on the forefront of raising issues and then trying to get solutions to those. So I will add some links into the chat box of where to find some of those resources. But one thing that I would encourage people to do, anyone who has had the impact of being furloughed or losing your job because of COVID-19, apply for unemployment insurance. Take the time. We know that it's hard to get through the website at times, but keep trying. We are backdating applications when we know that the website has been a hurdle for people. That gets you in the system. It'll start getting you some financial relief so that you can make some of those budgeting decisions going forward. And if you're a small business or you fall into one of these other categories, go ahead and ask for that assistance. We are doing the hard work of getting this money so that it can go to you guys. So I know personally that particularly our mountain and rural communities have a strong sense of pride of picking ourselves up by our own bootstraps. We are in this together. This is not supposed to be something that you think you should weather by yourself. So look for those resources that are made available for you. And Representative Roberts and I will continue to use our various social media accounts to push out things because this will be an ever-evolving issue. So an extended answer, if you have any questions on any of those, just email Rep. Roberts or myself. We'll put our emails in the chat as well. And like I said, our offices are open. We're here to help you guys navigate and make sure you get the resources you need in this tough, ever-evolving, and really unforeseen time.
Yes, thank you, Kerry. And I'll just echo everything she said. I'm happy to answer any questions you have at any time. You know, the rules around these things are changed and being loosened up, if you will. Like unemployment insurance is applying to a whole lot more people than it typically does. So like Senator Donovan said, if you think you may have a claim, go ahead and file it. And there's a good chance that it's going to get honored and you will receive some unemployment insurance. There was a question that came in the chat box while you were talking, Kerry, about the SBA loans. It's my understanding that the federal package that is going to be passed hopefully today are different than normal SBA short-term loans because they will be forgiven if you continue to pay employees during the time that you're receiving the loan or during the time of this pandemic. So unlike typical loans where you have to pay back, these loans can and will be forgiven. Some good help from the feds. Also, always a good message to keep contacting your federal members of Congress as well if you have ideas, and Senator Donovan and I are happy to pass messages on if you want to send them to us first. Let's keep going since we're a little bit short on time. There were a lot of questions about, there was a question about Governor Polis holding regular press conferences. Yes, he has been holding a press conference every other day for the last week and a half, I believe. They're typically not streamed on the national news, but they are streamed on our local news stations as well as the governor's Facebook page. In fact, he is about to start a press conference probably right around the time we get done here. I think 4:30 or 4:45 he'll be giving a press conference today. Governor Polis is doing his best to keep people informed. And to that end, there is a Colorado-specific coronavirus website, covid19.colorado.gov, where the executive branch is keeping you up to date on everything that they're doing. We've gotten a lot of questions about stay-at-home orders. We heard Commissioner Corrigan from Routt County mention that Routt County may issue one of those soon. We've gotten a lot of folks from Eagle County and over in the Roaring Fork Valley wondering if Eagle County and other similar counties are headed in that direction. Why or why not? I think Heath or the Eagle County Commissioners may be best to answer this one, so I'll turn it over to them.
Cool, this is Heath. I'm happy to jump in right there. And I tried to lead with this a little bit, but again, one thing that I really want to highlight is that when you look at the fine details of a lot of these orders, whether it's called a stay-at-home order or it's not, the details within the order are really similar. I've had the opportunity to look at the orders in Pitkin County and Denver City and County, also along the West Coast, even in New York City. And so a lot of the elements in these orders are really similar already, and some of it might just be about the framing. So one thing that I really want to focus on is that our message is, and it will continue to be, that we want people to stay at home as much as they can. Only go out when accessing essential services like groceries, medications, and things like that. We have very clearly asked that visitors and tourists and even seasonal employees return to their primary residence. We know certain circumstances might be a little bit more challenging, and so we haven't issued sort of a more formal order to vacate right now, because what we don't want to do is necessarily make it a little bit more hard or difficult for some individuals. But nevertheless, what we really want to do is make sure that if your primary residence is not in Eagle County, then we really want you to just stay at your primary residence. There will be a time that we will gladly welcome you back into our community, but that time's not right now. I think we want to also continue to ensure that our most vital services in the community have the support and will continue to operate through these difficult times. So our local nonprofits, as an example, even some childcare centers, so that some of our healthcare workers can remain on staff. They're critically important, and these are things that we're making sure that we're finding that balance in terms of what we really feel is prudent in the public health order, i.e. what are those areas that we are likely to see community transmission? And so a lot of those are going to be in larger congregate settings. And again, we've already limited the congregate settings down to 10 in Eagle County. And we did that on March 18th. So I think it's also really important that we continue to monitor what the social and economic impacts are for some of our community members. We have a number of community members that were struggling long before COVID-19 arrived in our community. And so we're also trying to balance, again, not jeopardizing health and safety, but trying to find that right balance where the workers that can still go to work and are helping to provide some of our essential services still have the means to do so. And so those are the things that are really important. So what I want to say again is our order right now is very similar to all of those orders. Some of this might be framing, but I want to again highlight that our message is and will continue to be, we want you to stay at home as much as you can and only go out when you're accessing those essential services like groceries and medications.
Thank you, Heath. Do the commissioners have anything they would like to add to that about decisions about stay-at-home orders?
Hi, Dylan. Kathy Chandler Henry. I think Heath covered it really well. We are looking at trying to balance doing the absolute best we can for public health with looking at social and economic recovery. So if there are businesses that can operate under the constraints of our public health order, that they can keep social distancing, they can limit the number of people who are accessing their services, or maybe they are a business that works like the gypsum wallboard plant does independently. They wear masks and gloves in any case. We don't want to shut those businesses down. We want to keep our economy running at even if at a very minimal level, if we can do that while protecting the public health, and we believe we can.
Thank you. Commissioner Corrigan, anything Routt County specific? On stay-at-home orders?
No, I mean, we have a policy group that's been set up to advise our EOC and the commissioners, and they have given us a recommendation that we put together or put into place a stay-at-home order. I think the devil is in the details. We haven't determined what those details may be. I'm sympathetic to some of the comments coming out of Eagle County. We don't want to shut down our economy either, but we are very concerned about obviously the spread of the virus and what we can do in the short term to flatten the curve, as Senator Donovan said. So I think it's going to be a pretty robust discussion that we're going to engage in starting tomorrow as we arrive at a decision point on some kind of a stay-at-home order.
Thank
Dylan,
you.
can I add?
Yeah,
Dylan, can I
please.
add one thing?
Go ahead.
Commissioner Jeannie McQueenie here. I just wanted to say our order, although we want people to stay at home, we do want them to go out and get some exercise and fresh air. Just to do that in alone or with family members, and not to be congregating in groups. But a walk around the neighborhood is a good thing for everyone's mental health. And so if we don't, the term stay at home is a little bit confusing. I think our public health order, which clearly says these are the businesses that we're asking to close as opposed to stay at home, it's just a little bit confusing to me. And people are confused when they hear stay at home and they see people out walking. And we do want people to go out and get some exercise and do those activities alone.
Thank you. Going off of the question earlier about helping families recover, we've gotten a few questions from teachers and other folks, working people on the call or prior, about how are we going to help families who face job loss during this time and may have to leave the valley. What are both communities or both counties' plans for economic recovery? And if there's anything that you can share about the school year, whether it goes to the end of this school year or may even push into the fall of the upcoming academic year. Whoever would like to.
I keep repeating what I heard the governor say. It is highly probable that the school year will not open. The remainder of this school year will not open. Our superintendent has not said anything as of yet because the governor's order went beyond what he had originally put in place. The governor's order actually brings them right to their spring break. So it will be interesting to see how the school year plays out. I think it was really helpful of the governor to make it clear that state testing has been suspended. That was causing a lot of anxiety for our students. But I also think on the other hand, it's good for them, for the students to know that school may be starting again, because it keeps them engaged with the work that they're being assigned on a daily basis. So I think that is a good thing. In terms of economic support for families, again, reach out to our Human Services Department and see what they can help with. If it's around rent or mortgage payments, we don't want to lose members of our community. We know this is an expensive place on a good day, and we want people to be able to recover and get that good paying job back when we're able to recover. So I hope that what we've put in place with Human Services will allow people to have a little bit of relief and stick around.
Thank you. I'd like to go back to a medical question. We had a question come in about fighting the virus itself. And the question is, can the BCG vaccination be a good protection against the virus? And then remdesivir or Plaquenil, are those options as well? So either of the doctors on the call that may be best for.
Sure, so I can take that question. I think, there's a lot of anxiety about both the prevention and the treatment of coronavirus infections. And right now, what I can tell you that's completely up to date based on clinical trials that are ongoing today, there are 9 different medications being looked at for the treatment of patients that are infected with coronavirus. And there's 1 medication being looked at for the prophylaxis after an exposure of a patient that is known to have COVID-19. In regards to the vaccine question, there's 1 vaccine currently in trial in the United States, and there are 3 different vaccines currently in trial in Asia. And the BCG vaccine in particular is a non-specific vaccine it's a vaccine that's used to give you immunity versus tuberculosis. But in clinical trials, there's been some evidence that it can also have some non-specific protection to patients that get sick with respiratory viruses. And so right now they are actively enrolling patients, particularly healthcare providers, and exposing them with the BCG vaccine to see if they're going to have any level of protection against acquiring COVID-19. Both international and domestic health organizations are actively trying to evaluate the safety and efficacy of multiple medications, as well as identify any type of prophylaxis or vaccine option that we have. Right now, there's not a lot of great data for any medication in particular.
Thank you. Question for any of the medical folks on the line. Yeah, Senator Donovan.
As you can see in the comments, but just so everyone isn't reading that, the governor in his press conference just announced a stay-at-home order for the state that will be effective Thursday. So we'll post some more information on that as we get it.
Great. So we've got a few questions coming in the chat box about ventilators. If any of the medical folks on the call can give a status update on how we feel Eagle County, but also the Western Slope in general, if you know, is doing on the amount of available ventilators right now.
This is Will Cook. I'll start and then ask some of my clinical colleagues to chime in. Bell Health has 29 ventilators. We currently don't have a patient on ventilator, I believe. There's a lot of literature out there about if things got really difficult, how can you get more out of one ventilator than just for one patient? And there was a study that actually came out of, I forget which academic medical center it was, that would expand our capacity there. I know that Colorado Hospital Association has been working on collating all of the various hospitals' capabilities so that we would know, as an example, how many ventilators are not just at Vail Health in Eagle County, but how many are at Aspen Valley Hospital in Routt County. And I see Dr. Bach trying to talk, and he's much more knowledgeable about this than me, so I'm going to turn it over to him.
Well, I think Will has explained it very well. We have a number of ventilators that are currently available at Vail Health, and fortunately, we don't have any patients at this moment requiring a ventilator. That's a very positive thing for our community, and so we're well prepared. And if we have a major surge, we will be looking at alternatives to what we have available here.
Thank you. And for the Routt County folks on the line, I did hear from UC Health in Steamboat, Yampa Valley Medical Center, that they feel confident in the amount of ventilators that they have, and at least as of right now, and would be able to handle a slight surge in need at this moment. So, so far so good there. Obviously things can change. I think we have time for two more questions. One was about what are we doing about our county jails and preventing the spread of coronavirus amongst closed populations such as that. So I would like to start with Commissioner Corrigan, and then we'll go back down to Eagle County.
Our county jail has instituted a number of steps to keep prisoners apart as best they can under the circumstances. The 14th Judicial District has just issued some guidance that allows for release of a lot of prisoners on personal recognizance bonds. So we are doing everything we can to limit the number of prisoners in the jail. We're also allowing more appearances by phone instead of in-person appearances for court hearings.
Thank you. All right, Kathy or any of the Eagle County commissioners?
Yeah, I will weigh in on that. We've got 5 strategies that we are taking at the Eagle County jails. The first one is to decrease the number of inmates. That helps, of course, with social distancing. The jails are following the County Sheriffs of Colorado guidelines to do that, and it appears to be working. We've gone from an average census of 56 down to 32 people in our jail, so that helps. We're doing some extensive screening prior to admitting anyone into the jail, looking for temperature, looking for other symptoms. If anyone is symptomatic at all, we do have a negative pressure holding cell where they are placed to further evaluate their symptoms. If we have inmates who are finished with their time and are released and are symptomatic, or they need to be released because they are ill, public health has quarantine and isolation measures that they are working on with the jail. And the last thing is that we're working with the judges and the district attorney's office on bonding and release to reduce the number of inmates. And we started working on these before we had our first case of COVID in the county, so the jail is feeling pretty confident about where they are right now.
Excellent, thank you. The final question we'll go to, I think, is instructive for a lot of folks, especially now that we do have a statewide stay-at-home order, is this virus changing, or is it the case that this can affect people of all ages? The specific question is, can the virus mutate to become more potent for young people? I think the misconception about this earlier on was it only impacted those who were older or who had vulnerable health conditions, but I think the data is showing that's different. So I wanted any of our medical folks to weigh in and sort of, as we wrap up here, issue a broad directive to our communities about how important it is to socially distance ourselves no matter your age.
I'm happy to weigh in on that one. The virus has mutated, that's been shown, and it will almost certainly continue to mutate. The studies that we saw coming out of China showed that the elderly were principally, if not almost exclusively, impacted. But what we're seeing now in what's happening in the United States and happened to a degree in Italy is that this virus has affected people from 20 on up in significant numbers. And we've even had folks in the pediatric population test positive in Eagle County. So this is a virus that is virulent, dangerous, and can affect any of us. So there's no one who should not respect the stay-at-home orders and the social distancing requirements.
Yeah, if I can add something real quick, I know that there was a study done on some of the hospitalized cases in the United States just to try to understand if what we're seeing in the United States is similar to what other countries have seen. And so for a lot of that information, the answer is, yeah, we're seeing the same thing. We know that that hospitalizations are more likely to occur for people that are over the age of 60 or have underlying health conditions. The other thing I would highlight, though, is 20% of those hospitalizations 20% are actually occurring in people then that don't meet sort of that high risk criteria. So those would be people that are under the age of 60, may not have underlying health conditions. So similar to what Dr. Bach just said, I think we all need to pay attention to COVID-19 and the impacts that can have on any age.
Thank you both.
And then maybe one final thing to share is that even though a younger person may have a milder illness, he or she can certainly still infect multiple other people. So those are the reasons for social distancing, staying at home, isolation when you're ill, etc.
Excellent, thank you. All right, we're over our time, and I know the governor is speaking, so I want to give Senator Donovan a chance to quickly wrap up, and we'll kick it over to her.
Not much to add, just gratitude to everyone who joined the call today. Thank you for adding information in a time where we're seeing a lot of rumor and conjecture. So it's always important to make sure you're seeking out informed people, and we certainly had those on the line today. For everyone who is working in healthcare right now, immense gratitude. You guys are on the front line of a scary situation, and you're taking care of all of us. Well, I'm sure many of you have families at home that you are sacrificing for. So we appreciate you guys so much. And to the county commissioners that joined us today, you really have been the lifeline from the administration to making actions on the ground. And I just have admired so much the lead that the mountain communities have taken in the state and really showing the way in a time of crisis while we're all dealing with perhaps the personal tragedy of losing someone who is close to us or the scariness of wondering if we're next. And for those of you who joined us today, thank you for taking some time. I hope this provided some information for you. Continue to ask us questions, to seek out help. But most importantly, I want to end with a message of we will get through this. It is really scary. I've had moments in the past handful of days where I've just ended up crying at the end of the day, feeling overwhelmed and helpless. But the next day, there is a bright moment or something that shows that there is a pathway forward on this. And we are here to help anyone who needs it in whatever capacity. If we don't know the answer, we'll find it for you. So it's been an absolute privilege over the past 6 years to serve Senate District 5. We've tackled a lot of issues. So I know that together we'll be able to tackle this as well. So thank you, and everyone, take care of yourself.
Yeah, thank you, everybody. Thank you, Senator Donovan, for helping me host this town hall, and want to echo the thanks to everybody who joined the meeting today, both as a panelist, our public health officials, our county commissioners, our doctors, Vail Health, giving a really important perspective to this issue and giving some new information, I think. So hopefully it was helpful for everybody that tuned in. Thank you for taking the time. As Senator Donovan said, these are tough times and the mountain community is getting hit very hard. There's no way around that. We are at the front of this on the state level and to a national level to some extent, but we will get through this. As state legislators, we are here to help. I know everybody on this call is here to help, but we are here to take your concerns, your ideas, your questions. And if we can't get you an answer right away, we will get you an answer at some point and make sure that you're heard. This is an incredibly difficult time. There's no way around that, but we're going to get through it. And I'm here to help you and serve you. So it's an honor to be with everybody on the call today. And please be in touch. Our contact info is everywhere, but we'll type it in the chat box again. We'll post this recording online so people can watch it again if they weren't able to get in. And please be in touch, and let's get through this together. Socially distant, of course, but we'll get through it together. So thank you, everybody.